This video will review the characteristics of barrier accessories for ostomy pouching systems. Barrier accessories come in a broad range of formulations. There are toothpaste, there are Strippaste, there are rings, and there are sheets. There are a variety of properties that should be considered when you select these products for your patients. The properties to think about include the pliability or their flexibility, the amount of erosion resistance or moisture absorption, the ease of use and their ability to dose correctly, the presence of alcohol in the product, and their relative cost. We're going to review the commonly available barrier accessories, looking at individual merits and concerns. It's important to note that there's no universal language for describing or grading barrier accessories. Most descriptors come from clinician experience. So the very first one that we're going to talk about are the toothpaste, and all of the companies have a paste that comes in tube format. They're all somewhat misnamed in that they're called a paste, and that implies that they're actually glue or that they're adding an additional glue, when in fact these are more like a filler. They're caulking, and they're a place to fill in a gap or a crease. So if you have a patient like this who actually has a crease on either side and you were to use something like a toothpaste, I'm just going to show you when we dose it out here. Is that you've actually got a very soft and pliable product here. This has got no rigidity to it whatsoever, so it has a lot of flexibility to it. It has a moderate amount of moisture absorption. All of the barriers actually have similar formulations, and they all have properties or ingredients in them that actually allow for the absorption of moisture. And there is a certain amount of I guess, what's the best term? Probably that they would puff up or absorb the moisture, but they also will wash away and erode. So if we go back to this particular example here, if you think that you're wanting to fill in the crease here, okay, is that you have to think again about what happens with that patient if they change position, right? And if you've got a soft pliable paste in there, is that it may not actually prevent the erosion that you're looking for. So you might want to be looking for an alternate. When you're typically using a paste, is that you want to make sure that there's a good bead. We're using this usually to fill in the gap with the traditional barriers. When you size the barrier opening, is that it's usually about 1/8 of an inch or 3 or 4 millimeters larger than the base of the stoma itself. And for that exposed skin, we're typically wanting to protect that with some sort of a barrier accessory. So if you were going to apply that on the back of this, is that you would want to apply a very good bead of paste all the way around that opening like this, okay? And once you've done that, is that you would then apply it over top, and you should actually see the paste bubble up over top of the stoma. And you don't want to wipe that away, you want to leave it in place because it's actually going to provide a good seal. Remembering that this is not actually glue, this is not adding adhesive onto the back, it's a filler or a caulking. All of the barrier, or all of the toothpaste rather, have got alcohol in them, so that if you do have broken skin, is that they can cause temporary burning or discomfort. There is one paste that's available that has no alcohol in it, and that is, or from a toothpaste perspective, and that is Econ paste, and that's not easily or readily available to us here. So again, if you were to use something like that, you would probably not obtain the erosion resistance that you're looking for, or the resistance to the stool that you're looking for. In general, toothpastes are not recommended for individuals with a urostomy, but they're used for individuals with a ileostomy, and depending on the consistency of a stool for a colostomy, you may or may not use it. The next grouping is Strippaste, and probably the most commonly known is this one from Coloplast. Hollister also has a Strippaste. I don't actually have an example of it here, but it has an awful lot of what we call memory to it, meaning that when you distort it or you play with it, is that it actually wants to go back into the shape that it originally started out being. This one from Coloplast is a little bit different. So this has no alcohol in it whatsoever, and you can dose as much as you require for that particular use. So it may be that you actually want to tear off a little piece to be able to put into the crease or the fold, or you want to use a portion of it to be able to turn it into a circle so that you can use it in place of toothpaste. And because it has no alcohol, of course, it's not going to cause any discomfort to the patient. So if you want to dose it, you would actually just pull off a portion of it like this. And as I said, you could do a couple of things. You could roll it in between your hands like this. You could fill in your crease on either side, and you could take off a portion and fill in your crease on either side, and then continue on with your regular pouching. If you wanted to use it for a in place of toothpaste, again, you would roll it in between your hands like this. I always say to the patients, you're going to turn it into a sausage. You're going to take your sausage and you're going to turn it into a donut. And then you would put the donut on the back of your barrier. So you would peel this off. And as I said, my preference is to actually put it on the back of the barrier like this. Make sure that it's attached, and then you would apply that directly over top of your stoma and put your hand over top to warm it up. So there's a lot of flexibility. As I said, with the Strippaste, it doesn't have any alcohol. It has a moderate amount of, moderate to good amount of erosion resistance. Again, that is really somewhat clinician biased and based on experience. And it will absorb some moisture and actually puff up around the stoma when in contact with the moisture from the effluent. The one thing that I did talk about, forgot to talk about, was the amount of dosing that you can get out of a typical tube. You can usually get, a patient would probably get about a 2-month use out of this, and most tube pastes are probably in the range of about $17 to $22 for a single tube. Strippaste, as I said, you can, depending on how you're utilizing it, how large the stoma is, you can either get a single use out of it, or you can get multiple doses out of it depending on your utilization. And these are a tad over $3 each. So again, may be cost effective depending on what your utilization is for that particular individual. The next grouping are rings, and that's probably the largest grouping out of all of them, and they have a broad range of formulation, I shouldn't say formulations, probably shapes and sizes that are available to you. And again, they don't have any alcohol in them, and they come preformed. The most commonly used or your recognized ones are these round ones, although what we're starting to see now is that they actually come in what we call a regular thickness, and then these are called the slims, and a couple of the companies have now got availability in a slim version. Econ and Coloplast have thin versions of it. So again, there is a lot of flexibility associated with the utilization of these rings. There's tack on both sides, so there's no right or wrong to it. And these have no memory to them, so that when you actually stretch it out into the shape and size that you want, is that it will actually stay there. It's not going to want to pull back into the original shape that it started out with. One thing you do have to take note of is the more you stretch, is that you actually make it thinner. Okay, so you have to think about what it is that you're wanting to utilize it for. But if you have an oval shaped soma, is that you can actually stretch it out to the oval shape. But if you have a round shape, is that you can actually, again, put that over top of the stoma. The one thing with all of these barrier accessories is that they have no plastic shield or covering that actually helps to support it, like you would see with a barrier. So that means that these can actually touch the stoma and you're not going to be concerned about laceration or any kind of damage to the stoma itself. There are other rings that are available, and these ones are from Hollister. These are their convex barrier rings, and these are the only ones that are available. All barrier rings will actually add some degree of convexity, but these are far more pronounced. As you can see, that from the side, or the shape is that you've got quite an elevation and you've got a tapered edge. They originally came out as this shape right here, which is the round one, and they have 3 different sizes. And when you manipulate these ones, you're going to notice quite a bit of difference from the other barriers in that they have a lot of memory. So when we stretch it out to that shape, it doesn't take very long and it wants to actually go back to its original shape. So that can be a little bit of a challenge when you're trying to teach somebody in terms of actually manipulating it. So that if they have their barrier and they're wanting to put it on the back of a flange, is that you really have to be quite careful and quick that you actually stretch it out and place it onto the back of the flange at the same time. And that may be a little bit more of a skill set than somebody feels comfortable doing, okay? But it does add, as I said, a fair amount of convexity on the back of a flange. So if you're not getting enough convexity with the flange that you've pulled off the shelf, it may be by stacking this on top of it is that you'll actually achieve the convexity that you're looking for. These are extended wear barriers, so they absorb an awful lot of moisture, and things to be consider is that they, in contact with the skin, if you're getting an extended wear or long wear time, is that you may see a little bit of maceration, or the openings may be actually too tiny and they will swell up and actually occlude the opening. So be careful of that with your smaller stomas. These convex barrier rings now come in an oval shape. And again, the same idea is that you can distort it and stretch it out into various shapes, but you're going to see that it wants to actually go back into the shape that it originally came out of the package. It does have these little, I'm not sure if you can notice that there's these little tapered edges top and bottom. So these are actually quite good for individuals that have fistulas or heavily draining wounds and you're wanting to pouch that over top, and those little notches fit in there quite nicely. Barrier rings also come as in larger sizes like this, okay? And again, it's the same idea, is that it's just a larger version of the smaller ones that we saw earlier, is that you would actually want to stretch that out into the shape. They're fairly thin. They're probably closer to a slim version of the smaller rings than they are the thicker ones. But if you have a large area of open skin on the surrounding area, or some people use this as an interface between their pouching system and their skin, is that this is an option as well. All of the barrier rings are relatively or comparatively expensive when you think about the range of prices that you see here, and the rings will start anywhere from about $6 for a smaller ring like this, and when you start getting into the larger rings or to the oval rings, you're starting to get closer to $9, $10, $11 for them. Lastly, we have barrier sheets. These come in a variety of sizes as well. So you may have a sheet that, like this one, this is an Econ sheet that comes obviously rather elongated, and you can actually cut this up or dose it into smaller pieces, or you can utilize it as a whole sheet depending on what your purpose is. We have extraordinarily large sheets like this one, and again, multiple doses, or use it as a whole, and then you can get smaller sheets like this one that are probably about the footprint size of whatever pouching system that you're utilizing. So these have a place in ostomy care. Again, is that if you want to utilize it as an interface between your existing pouching system and the skin, is that something that can be utilized to apply over top. If you have somebody like this who has mucocutaneous separation and you're utilizing a powder to fill that in, and you want to be able to secure the powder, I'm going to just move that over like that, is that the barrier sheet can actually be used to hold the powder in place without having to worry about the toothpaste causing burning or discomfort because of the alcohol associated with it. You can, as I said, you can take little strips of this. I'm actually going to cut a little piece off here. And depending on what you want to do, as I did with that other sheet, you can either cut a hole in the center to match your stoma and use it as that interface, or you can take those little pieces and again use that to actually fill in any creases that you may have. You can actually roll and manipulate that so that it fills into the crease. Okay. On the range of cost, probably in the sheet can be anywhere from about $6 to about $12. Again, depending on the dosing or how you're utilizing it, it may be cost effective or it may be an expensive portion of their care. A couple of newer options, and as far as barriers go, there are these flange extenders, and these go on the outside of a barrier. So if you've got somebody like this who feels that they need to have their barrier extended, is that you would actually take this extended or this half moon shape that's preformed for you, and you would apply it to the outside of the barrier like this. It may require 2 or 3 depending on the size of the barrier to go around, and these are probably running in around $1 to $1.25 each. And there's a hydrocolloid as a strip, so again that you have multiple places where you can actually dose it, and this may be good for using over a little area that might be ulcerated, and you're using it to secure a dressing over top of that peristomal ulcer. Actually even good for peri-wound skin protection. Just going to go back really briefly to this, is that the utilization, as I said, of a barrier ring may be that you want to actually fill in curves and gullies. So if you can look at this from the side, is that you can see that the stoma is actually within a gully, that it's under tension, and that you have a flush stoma. So you're looking for some degree of convexity to want to be able to fill that in and compensate for this so that you don't actually have a leak. And that's where a ring may be sufficient for you, so you might actually be able to stretch that out. As I said, it's okay for it to fill the stoma, or to touch the stoma, but if you see how that fills in the shape, then you're going to start to understand or appreciate whether or not you actually have enough convexity, and whether you've distorted those body contours sufficiently to get a seal. So probably that slim is insufficient. But if we were to take this, the convex barrier ring, and fill that into the shape like that before we would put our barrier on, you can start to see that you're actually getting closer. You would need the smaller size, but you could actually see that you're getting into filling in those dips and gaps a little bit better, so that you would be looking for a deeper convexity. If you require more information about pastes, strips, rings, and sheets, contact Joe or the customer service lines for the major suppliers in Canada.